by Dr. Pradeep Kumar. He is the doctor who has been treating the 3 patients who are admitted in Brookfield Hospital. So just a quick update about the woman, Mrs. Swaranamba, who is now in ICU. Tell us about her.
So, as I mentioned to you all, Swaranamba had a little turbulent post-operative period in the ICU as a result of the extent of injury, the duration of surgery. So, her blood pressure had dropped down, her blood sugar had gone up. So, as a result of those things, the condition was a little critical overnight. But as of today morning, her condition is stable. She has started taking oral liquids. Her blood pressure is stable. Her blood sugars are stable. She's talking. She's met up with the family members. They are happy with the progress that is made. So by God's grace, there has been significant improvement and response to the recovery that she has made so far.
So you mentioned yesterday that she'll be undergoing a plastic surgery.
So that surgery was done yesterday night as a result of effort from 3 of our team of surgeons and anesthetists and intensivists. The surgery lasted for almost around 3.5 to 4 hours yesterday evening from 7 to 10:30, 11. And we had done an extensive surgery of a earlobe repair, exploration of the wound, removal of foreign body, flap dressing, along with excavation of skin and collagen dressing. So these are the extent of surgeries that was done on Swaranamba last night.
How are the other 2 patients doing, sir?
One of the patient is likely to be discharged by today evening. He continues to show great progress. He's only having stress-induced effects. Psychologists will probably be treating him and counseling him, and post that she should be fine. The other patient who's there, who's an employee of Rameshwaram Cafe, he seems to be recovering well, and the injuries are responding well to the treatment that is being given, and he will probably discharge in the next 24 to 48 hours.
Well, sir, that's a huge relief. We're all really glad and thankful that all 3 of them are out of their danger zone, and very soon we can expect them to be discharged. Huge congratulations to you as well, sir. But then we also want to know about the kind of mental trauma that the patients are undergoing. What are they like, sir? I know it's a very sensitive topic because, in just a split second, their lives were changed forever. Just take us through their mental status at this point. So what treatment are you giving them?
So as I told you, there is something called as a post-traumatic stress-induced psychological changes that these patients go through. So there would be a transient impact for some people. There may be a delayed, prolonged impact of this. So to overcome this, we have a counseling session by a team of physiotherapists and a psychologist along with a psychiatrist. So it is being treated in a holistic manner. So we would try to build a confidence in them, give them the encouragement to say that this was a one-off kind of an incident, and we would expect them to recover faster with the support of the medical staff and the psychological support that he is receiving currently.
One quick clarification. Where was the lady standing, sir? Was she very close to the exact spot where the bomb exploded, or where was she in the restaurant?
Considering the impact of injury to all the 9 victims of this particular blast, the maximum injury has been to this particular lady. So as a result of this, logically speaking, she should have been on the blast should have occurred to the right side of her body, because the entire right side of the body is what is affected. So that's what we can clinically assess and say based on whatever extent of injury and damages that we have seen across from the other patients other victims put together.
What are family members doing, sir? Does she have kids?
Yeah, she's got a kid who's doing his first PUC. He's also here. The husband is a KSRTC mechanic. So they are all here. They are essentially from Girinagar, but they're natives of Mysore. Their family members are all here. We have taken care of them. We have given them accommodation within the hospital to ensure that whatever support could be given has been done. So they are quite happy with the progress that the patient has made and the way that she is being taken care of.
Thank you, sir.